Hello and welcome to the Digital Innovation, Patient Experience, and Marketing virtual event and our featured session, Digital Front Door, Modernizing the Healthcare Consumer Experience. I am pleased to introduce our speaker for today, Ben Dillon, Chief Strategy Officer at Geonetric. Ben, thanks for being here today. I'll turn the floor over to you to introduce yourself and get us started.
Thanks so much, and thanks for everyone for joining us for the Becker's Digital Innovation, Patient Experience, and Marketing virtual event. We're really excited to be talking about modernizing healthcare digital consumer experiences today. And it's been a really interesting time in healthcare. We're in the midst of this near perfect storm right now. We're coming out of the pandemic, which I think was a unique experience for healthcare organizations. 2022 was supposed to be our get back to normal year. And of course, it was anything but that. And we're experiencing all sorts of problems that are still preventing us from getting things running the way we want to, getting back up to full capacity. And through all of this, we've got challenges around patient loyalty. We have more new competition than we've ever had before. And bottom line, this is just the way we've worked in the past isn't going to cut it as we go forward. We need to find new ways to compete. And we feel like digital is one of the areas where many of those opportunities live. As was mentioned, I am Ben Dillon. I'm the Chief Strategy Officer for Geonetric. And we are a web development and digital marketing agency working exclusively in healthcare to create compelling digital experiences designed for the unique needs of the healthcare industry. Using our own VitalSite content management system or using off-the-shelf digital experience platforms like Optimizely, we've been crafting award-winning digital experiences for many top healthcare brands from around the country over our 23-year history. Now, through the presentation today, there's a lot of data that I'm presenting here. It is a small fraction of what we've got from a couple of surveys we've run recently. One of them is from 2021, a healthcare digital marketing trend survey, and we've run this many times over the years. It's an industry perspective on what's going on, talking to many people running digital within health systems, hospitals, organizations like that, as well as a second data set looking at vendors and agencies and other folks that help support them. So it's that inside the organization kind of view of what's going on, how we're investing, where we're growing, things of that nature. Last year, we shifted it up a little bit and we did a consumer health survey. And we really wanted to look not just at how people within the industry are viewing these things and are trying to push things forward, but get a stronger perspective on how consumers want us to be engaging with them using some of these digital platforms. So both of those surveys are available. If you go out to geonetric.com/Beckers23, there's some other resources on that page as well. I know the Reinventing the Healthcare Digital Experience ebooks on there, which is actually an excellent companion piece to what we're going to be talking about today. So let's jump into it. And I want to start with the crisis of loyalty. And to be fair, we've been watching this even before the pandemic. Things were starting to feel, I think, shakier than we wanted them to from a patient loyalty perspective, even in 2018, 2019. And this was at a time when a lot of organizations were talking about medical home and other strategies, other payment strategies that are centered around the premise that a consumer would largely stick with one healthcare organization for all of their care, barring some major event in their life, like moving away or something like that. But it seemed like that premise wasn't holding up as well as we'd like. And then, of course, the pandemic hit. And the pandemic did to loyalty what I think it did to a lot of the general trends we were feeling out there, which is to say that over the course of those 2 to 3 years, it moved things maybe 10 years forward in terms of the progress that we were expected to see around some of these shifts going on. This was the thing that really highlighted to us first that we were seeing this major shift as a result of the pandemic. And this isn't our data. This is from Rob Klein and Partners. He does an annual omnibus survey of healthcare consumers. And in 2020, he split that up to be able to track over the course of the year how consumer perspectives and behaviors were starting to shift. At the beginning, relatively early in the pandemic, in May, he asked this question, asking really kind of a variety of different possibilities. What would make you consider switching healthcare providers? And what he got was 41% of people saying, I don't see any reason why I would switch my doctor or any reason I'd switch my healthcare provider. Just a couple of months later, in December, that number had dropped to 18%. It carved more than half off just in those few short months. And with everything that's continued to go on, we haven't seen real evidence to suggest that that number has rebounded in a really significant way. So we wanted to dig more into this. And what we found was in our 2022 survey that 43% of the consumers we surveyed had received care from a new healthcare provider or new health system in the past 2 years. So in those intervening years, how many people had seen a new doctor? And that seemed high. We didn't have a baseline to compare it to, but that seemed high. But then as we looked at different segments, young health consumers, particularly tech savvy health consumers, these numbers were quite a bit higher even than what we saw from the population overall. And there are a lot of reasons why they change providers, and not all of them would constitute a loyalty issue, right? One of the big reasons that we saw out of this was that their health needs were changing. And when someone has a new diagnosis, an injury, a disease, or something else that causes their PCP to refer them to someone else, we don't think of that as a loyalty challenge. That's just kind of normal engagement with the healthcare system. But we had an equally large group that was giving us answers that just said, I'm unimpressed with the experience that I'm having here. Nothing here is strong enough for me to value this over other other factors around which I might choose a doctor. Giving us answers like, I'm looking for something better. I need better service. I want better options. It's time to try something new. And that's where we do see a lot of this shifting of providers, a lot of this changing happening out there. And unfortunately, it is pretty generalized out there. People are telling us over and over that parking was an issue. Like that'd be something concrete that we could easily solve. Instead, we really need to look at how we up our experience and build more meaningful relationships with consumers to start to try and patch this loyalty challenge. We also looked at what consumers were using when selecting new care providers. What's important to today's consumer? And, walking into this kind of assuming that the things that we may have thought we knew about how consumers prioritize this stuff in the past may not be true anymore. So there are some things that weren't a huge surprise, right? We had a couple of filtering criteria right off the kind of your must-haves. You have to take my insurance, and I have to be able to actually get an appointment sometime when I can go to an appointment. And if we don't do those two things, I'm not really going to consider you in any significant way. Not really any surprise there. The second set of items here were around price and quality, maybe a little bit more of a surprise at this stage. Price in particular, as the number 3 item here, I think that's a little different than what we've seen in the past. We haven't necessarily seen a huge amount of pricing sensitivity from health consumers in the past, but we're certainly starting to see in this data that it's a pretty major factor. And to be fair, our ability to communicate upfront what the costs are going to look like when someone needs care has been pretty problematic. And so we're really not delivering very well on that key element there. A little surprising to us as well. We kind of expected ratings and reviews to be clustered in with these two, and it's quite a bit further down the list. The next set of items here is all about convenience. And we know convenience is important to consumers: location, hours, ability to schedule online, ease of searching. Those things all clustered together and we're right there. In and of themselves, not that surprising until you realize that that whole set of convenience items comes ahead of, I have an existing relationship with this care provider. That's our loyalty challenge in a nutshell. People are willing to pick convenient hours or a convenient location, or the ability to know upfront what their cost is over, this is quote unquote my doctor. And I think that's a big shift from what we've seen with a lot of consumers traditionally. Add on to that the fact that we've got this changing competitive landscape out there. In addition to a lot of traditional healthcare organizations that have been expanding, growing their geographic footprint, acquiring or building new hospitals, new clinics, things like that, we're seeing an influx of new competitors out there as well, coming from a lot of non-traditional places. We've got startups with new care delivery models. We've got established retail players. We've got digital brands like Amazon who have, tried a lot of different things, from building things themselves, now acquiring and integrating some different capabilities, coming into our space and complicating things, providing more options for consumers in that process. Now, all of these organizations have one thing in common, and that's that they feel that there's a big opportunity here. They feel they can exploit this by leveraging some things that they're good at that traditional players, and that's most of us on this call today, just aren't good at. And some of those things are related to the overall experiences that we're creating. So we are seeing these new players growing, and that growth is coming at the expense of traditional care providers. Customers are attracted to the ease and convenience, and in some cases, the digitally enhanced experiences that are being offered by some of these new players out there. These things are easier, they're faster, and in a lot of cases, they're cheaper as well, or at the very least, consumers know what those costs are going to be, and that makes them more comfortable than the unknown that they may experience through some of our organizations. All of this is furthering our loyalty challenges. All of this is lowering the customer lifetime value that we're seeing from those patients. We wanted to get a sense, though, of the various trust levels that we see with consumers to a lot of these different categories of new offerings in the space. And so we asked this, and to try and even the playing field, we asked, how would you feel about receiving telehealth from this organization? And the good news is that being the local health system still carried a real trust advantage for this. Two things that make me sort of temper this a little bit. The first is for organizations that consumers are familiar with, particularly familiar with engaging around their healthcare, that trust advantage is pretty small, right? If your insurance company is offering a telehealth option, if your local CVS or Walgreens is offering a telehealth option, your trust advantage there is pretty small. It's there, but it's pretty small. It is bigger for, Target or Walmart. It is bigger for Google or Facebook. It's bigger for startup companies, but it's not as big for all of those players as it's been. The other thing that makes me caution people around this data is that this is not consistent across all consumer groups. So again, when we look at young consumers, when we look at particularly tech-savvy consumers, they are very open to engaging with some of these other new entrants in the space. And we're in an environment right now where most of our organizations have more patients than we can actually handle, that we have huge backlogs in a lot of our service areas. And that's an environment where, one, it encourages people to explore other options, but also we can't really see if people are peeling off and going to be treated in other places or through other organizations. We're just not seeing that yet. But many of those people that are peeling off and building relationships with some of these new players in the field, we're kind of assuming that they're going to be part of our core care demographic in 10 years or 15 years. And so if they're not building relationships with us, if they're not getting experiences with us, that puts us further and further behind when we're expecting them to be a core part of our market. So we see one of the key places to build competitive differentiation here or competitive parity here is to level up our digital experiences. And through the pandemic and through everything that's happened the past several years, consumers' expectations for what they should be able to do with an organization, the way they should be able to engage with a brand through digital channels has just exploded, right? Consumers often flock to best-in-class experiences wherever they might be offered. So we, engage with a lot of entertainment, a lot of retail, whether that's e-commerce or sort of hybrid retail, groceries, and ordering pizza and things like that, banking, all of these different areas where people have been engaging with the digital world has set a bar. And that bar then is what they're expecting from healthcare when we step into the mix. And right now we're falling short. Let me give you an example. Earlier this week, I ordered pizza for the family. And then I could look at that website and I could see if the pizza had been made yet. I could see if it was in the oven. I could see if it was in the box. I could see if the delivery person had picked it up. And then I could follow that driver live in real time as they drove to my house. There was no question if my order had been lost. There was no question, if it's coming in a minute or if I have 20 minutes before my pizza is going to arrive. It's intensive transparency to that whole process. So if the next day I then walk into my doctor's office and I have to wait an hour and a half because they're backed up and had no capacity to tell me that I may as well just wait at home before I get there, That is a huge miss of expectations there, and we need to close that gap in a lot of different ways. Now, as we ask people running digital and healthcare organizations, they have recognized this. So consumer experience is the #1 objective for people running digital in health systems today. This again is data from 2021. For contrast, we asked this same question in 2020, just coming out of some of the shutdowns in the pandemic. And in that situation, patient acquisition had leapt to the top of the list with a really high score for anything that we'd seen traditionally there. Now, that patient acquisition number has actually remained relatively consistent, but has now been leapfrogged by a bunch of these other consumer and patient-oriented goals. So consumer engagement, patient satisfaction, patient acquisition, and ultimately consumer experience. And there's a recognition by the people who run these initiatives in health systems, if they can create great experiences that really deliver value to consumers, the other goals, which are still important to them, are going to naturally flow from that. Now, one of the big challenges we're seeing as organizations are doing this is that we've got more and more digital touch points out there. Now, having more digital touch points is kind of a good thing, right? We're increasing the number of ways that we're able to connect with people. We're meeting them increasingly where they are, where they want to be. But as we add more websites and portals and apps and messaging and social media and all these other places where things are happening, many of these things have become siloed environments where the experience that people have from one point to another can be very, very different. And so as we go forward, again, it's time to level up. It's okay to be adding new things. I'd encourage you to add new things, but you need to make sure you have a core of people in your organization that are protecting a consistent experience, whether someone's picking up the phone, whether they're showing up in person, whether they're engaging through an app or a website or a portal or any of these different channels, to make sure that you're building a brand that's all about that experience. When the experience is all over the place, you're still building a brand that's all about the experience, but the experience is all over the place, and therefore your brand is going to be equally scattered. Now, we are seeing organizations really embracing more and more different tools in this mix. And that means more technologies in the marketing tech stack. And again, a lot of organizations have been building big plans for how they're going to put these things in place and really shift the way that they're engaging with their consumer base. We have seen a set of organizations in healthcare where conditions have kept them from really being able to execute on those plans the way they've wanted to the last couple of years. I do want to make sure those organizations are aware that there is a relatively sizable group within healthcare that has been able to really invest aggressively these last couple of years. So the organizations that have had to be conservative in the new tools they're bringing on, the new investments they're making, the way they're executing on what many of them have as plans in this space, are definitely behind the organizations that have been able to really focus on this and move things forward here over the last couple of years. One set of capabilities, one set of tools out there that I'd like to point people to is user experience. And this is a set of disciplines, experience research and user experience design, that have become really sophisticated over the last, I don't know, 7, 8, 9 years. But we don't see a lot of healthcare organizations really engaging them aggressively, really utilizing them to help assess where they are and to set their vision for where they want to be. So there's many tools in your user experience, audits, design sprints, all sorts of things that you can use to help lay out those plans, compare yourself to competitors, things of that nature. And we're finding it's a really important tool set for organizations to lay out that roadmap, as well as to build a business case to execute on the things that they want to do in terms of digital engagement. Now, this leads us naturally into some ideas around personalization and privacy. Personalization has been one of those topics within the digital space that's gotten a lot of conversation. We haven't seen lots and lots of organizations using it aggressively yet. And of course, to do this, we need to be touching a lot of data and building a lot of data into profiles to help us execute. So we asked consumers how they feel about all these topics. And right off the bat, we found that 60% of consumers in our survey said they're frustrated when healthcare websites show or recommend information and actions that aren't relevant to them. So we start with that frustration. An even larger portion, 79% of consumers in the survey, said that they expect healthcare websites to be personalizing that experience. And fortunately, the majority of the consumers in our survey also said that they trust us to protect the information that they understand we need to be putting together in order to deliver those personalized experiences. Now, from our industry survey, we have found that this is personalization technologies really are helping to level up digital marketing organizations and the things that they're doing. There's real tangible benefits that organizations can measure and deliver. And I will say that this has not always been the case. We've been asking this question over about the last 6 years. And early on, we got one of those charts that you look at and you're like, it feels like the people answering this question are angry, right? There are a lot of strongly disagrees in there. There was no strongly agrees. It felt like people were really frustrated with that early stages of personalization. And I think it's indicative of the fact that this stuff takes some time, that it takes an investment of time and effort to sort of build up those use cases and to do the testing and to get the data in and to really dial things in to make it work. And then to do that at scale, it just takes some time to build those disciplines up and to get those things baked into your organization's digital presence. We are finding though that the organizations that are investing are getting there. And as they get there, they are seeing some very real value out of this. Now, of course, all this data was collected before Health and Human Services dropped this bulletin in early December. Hopefully, most of you are already familiar with this or already working with your compliance folks around this. But it really stems out of some of the investigative reporting that came out earlier in 2022, focused on Facebook's Metapixel and using that tracking technology within healthcare websites, and in some cases, unfortunately, within patient portals and some kind of authenticated experiences there. The bulletin itself, is very clear that it's not changing the law. It doesn't do a good job of really explaining how it's shifting the definitions here, but it definitely does. It's definitely moving the boundaries that nearly everyone in our industry has been using for what is and is not PHI, and therefore the HIPAA implications of a whole lot of different things within the tech stack. And so if you're not already doing it, I encourage you to apply some close scrutiny to every piece of the tech stack that you have in place today, the marketing tech stack, and every piece of the marketing tech stack that you're bringing on board in the future. And of course, this could be a session all by itself. We're not going to get into any greater detail. I'm happy to connect after this with others who want to discuss this or compare notes. All right, so this gets us to the digital front door. And we're looking for strategies to level up our digital engagement. And it seems like the industry sort of adopted this digital front door nomenclature. It sounds great. It's got a nice ring to it. It lacks universal definition. And I hear different organizations talking about it, and I read every white paper I see on this, and the definitions are all over the place. As we talk about it, the way that we think about this is first and foremost building this off the recognition that consumers' expectations for digital aren't built off what you're doing today or your competitors doing today, but all those other organizations we've talked about, the Apples and Netflixes and Googles and Amazons and Zooms of the world. And when we look through that lens, we have a ways to go within healthcare. And so I like to think of this from the perspective of what we're trying to accomplish. Every organization's goals are going to vary a bit here. We need a starting place. And so this is what I'm going to put on the table here. For too long, healthcare digital experiences have been more informational than they have about getting digital business done. Health consumers get great information. They learn, they assess, they have, things to help support decision making that they've got ahead of them. But then ultimately, most of the time, they've traditionally still had to pick up a phone or head to a care facility to actually get things scheduled or get anything done. So as we think about this, first off, we really want to be all about expanding access to care here. And everything we're doing, or almost everything we're doing in the digital realm, has been about connecting consumers to the care they need. But to the extent that we can reduce friction, we can make that easier, that's going to be a real benefit here. We want extensive self-service capabilities for consumers. If they're coming to us and wanting to engage with us digitally, they want to engage with us digitally. They want to be able to do things there, not just look at things there. I think it's also really important that we have one nexus that really has all the tools to support patients throughout the journey. You can supplement that with tools and touch points in other channels at the places where they make the most sense. But we're seeing a lot of these experiences where the things are getting very siloed and disconnected because one stage of the journey is in one tool, but when consumers are ready for the next stage of the journey, they don't know where to go because it lives somewhere else. And we want to make this easy for consumers. There needs to be one place where they can go. And of course, communications throughout and that consistent brand experience across all of the touch points in the journey. So let's talk about that journey. When we built our consumer research, we took a pretty generic healthcare journey and then looked at how consumers want to engage with healthcare organizations at each stage of that journey. And we started with, those researchy tasks, looking at health issues and self-diagnosing, actually scheduling and holding the appointment, and then everything that comes out later, like paying your bill and asking questions of the doctor. And then we asked about what channels they wanted to use to engage. The red line here is the website, and this was sort of the across the board winner. As you can see here, as we compare it to phone, it's not the number one preference in every area, but it's close in the areas where it's not number one. And, kind of across the board, it was the place where consumers most wanted to engage with healthcare. This is particularly true. These are particularly strong early in the process, doing those researchy tasks. And we did dig into that a little bit more. And, no surprise, people are starting at Google. It is the homepage for everything that we're doing out there. As we move along and have the appointment and then do things further on, other channels have their moments within this. And so you can see for the phone, people are very comfortable doing appointment scheduling here. It beats out web appointment scheduling a little bit. People, are enjoying asking questions using the phone. It's preferable to the web, but kind of even across a lot of those things, people would prefer to engage through the web, and we've kind of included patient portal in there, that kind of browser-based experience, even over picking up the phone to do some of these things. There are other technologies that have very niche applications, but the preference in that niche application is really big. And so texting is a great example of that. You are not going to put up a texting service to pay your bill for the most part. They're not something that people are beating on the door asking for right now. But by golly, they love their appointment reminders here. And again, that's, I think, not a surprise to anyone. The one thing that was maybe a little bit more of a surprise was all the way on the right there. There's a fair number of consumers that would really like to be able to ask questions post-visit using texting. It's a technology they're very comfortable with. It's very easy. It's low friction for them. They would love to be able to use it for some of the other interactions with the health system, but it's a selective group of things where it makes sense. And of course, mobile apps. It seems like we're back to that. I need an app. I need an app. I need an app kind of world. And we're seeing departments across the board getting apps pitched to them that are very niche, siloed solutions. And again, those can be great, but you really want to make sure that someone from a centralized authority is looking at these things, see if they fit into the overall strategy and that consistent brand presentation that you're trying to put together across the board. Apps have a place. That place is not generally really early in the process, though, right? If you're trying to put together an app that's all about researching health issues and self-diagnosis, it's going to be a pretty niche tool. That is Google's domain, and that's not a battle you're likely to win in most cases. However, apps have a lot more applicability later in the process, and I sort of see this shift happening at the point where people go from consumer mode to patient mode. When I'm building a relationship, when I think, perhaps I'm going to be engaging with the health system a lot over a period of time here, that's the point at which going and finding an app, seeing if there even is an app, downloading it, onboarding, learning what's there, all those sorts of things starts to really make sense. I'm not going to do that with every care provider in my market as I'm evaluating options, but at the point when I have a care relationship, and maybe if I've got something where I'm going to be engaging with the health system pretty regularly, those kinds of things make a lot more sense. So there are a lot of applicability, a lot of things that make sense at that end of the spectrum. So at this point, you're probably asking, what does this all mean for me, for my organization? What do I do with these insights? How do I prioritize? And so these are kind of, the takeaways from my mind here. And first on that list is location, location, location. Use the right channel for the job. And again, I think it's important that we support as much of that journey for patients as possible in a browser. That is the place, first and foremost, they are telling us they want to engage with us. So let's meet them where they are. And then look at other channels like apps and messaging and things in those select places where that really makes sense for the particular applications, and do that more selectively. Make sure that you're serving up the data that consumers are really using to make choices, right? If you think back to how consumers are picking care providers, there are areas where we're doing a good job of delivering that information, and there are areas where a lot of organizations struggle. Right at the top of the list, the insurance that's accepted. Is that information you're collecting? Is that information you're presenting to consumers? Are you presenting it in a way that makes sense? Do you have the ability, for instance, to search for doctors based on the insurance that they accept? Um, a lot of organizations, it's just too much to collect that data and keep it up to date, and so they're not. That is kind of failing for a pretty core selection criteria for a lot of these consumers. Out of pocket costs, right? The number three item is I want to know what it's going to cost me when I walk in the door there. This is an area where we've really struggled, even with some of the regulatory changes. Very few organizations are really putting those out of pocket tools in that place in the experience when people are making choices. And a lot of organizations are bearing that all together. That's an area where we need to get better to compete with some of these other organizations, and they have an easier task. Many of them are dealing a much more limited set of services, but we need to figure out how to do a better job of serving this strong request, strong requirement from consumers. We need to up our game in terms of how we're allowing searching, and getting people connected with the care they need, right? If I go and I book an airplane ticket, I don't go and look at all the airlines and see when they have a flight available, right? I need a flight and it needs to go to this place and I need it on Friday. That's the way that we want to look for these sorts of things. There are almost no health systems in this country where you can search for a provider based on whether or not they have an appointment next Tuesday, right? We need to be able to get the data out of the EMRs, out of the scheduling systems in order to be able to serve really core needs from our consumers. And unfortunately, some of those vendors are doing a lot to hold that data hostage today. And then, of course, we still need to do a good job of selling the benefits of our organization and our providers. And I think most of us are doing a pretty good job of that today. Next up, appointmenting is really key. This is a list of many, many different elements of the digital front door experience. In our 2021 trend survey, we asked two questions around these. And the first was, how important is this for your digital marketing success in the coming year? And then the second question was, what are your current capabilities here? So at the top line, the bottom line, importance and capability. And the top two items here were appointment scheduling for new patients and appointment scheduling for existing patients. So we see this as a hugely transformative technology. At the bottom of the list were things like mobile apps and chatbots and virtual assistants like Siri skills and things like that. Those things are kind of shiny objects. I think they get an outweighted excitement in at the conferences and things like that. They're still pretty niche. So it's fine to be investing in things like mobile apps, but make sure that you're not investing that at the expense of a lot of the core capabilities that you need to be bringing to the table around integrating CRM or getting patient ratings or the ability to pay a bill. Now, when I talk about appointmenting, there's really two things that I'm getting at here. And the first is what I'm referring to as an appointment navigator. There is just this growing number of different care options available for most health systems. And the average consumer who honestly doesn't engage with the healthcare system all that often doesn't really know what's appropriate for the particular situation that they're in. So we need designed experiences that step people through what can be a very complicated workflow to figure out what options are actually options for the situation that they have and that they're dealing with. And you can do this within a browser. We've done some of these. I'm seeing some really neat stuff happening within chatbots, but I worry that when this is baked into a chatbot experience, it's getting buried from the most important places. The most important places, number one, it has to be findable by Google. That's the homepage for all of our websites. If I'm searching for, make an appointment, I want it to find a page where it's walking me through this decision tree and getting me to the options that make the most sense. That is the thing that I want to put. So we need to surface these things out of some of these technologies. The second is just if someone's working through that site, and at the point when they are making an appointment, let's surface it there as well. And since some of those tools allow you to pull it out of the chatbot, but don't leave your coolest, most engaging tools buried somewhere where very few of your visitors are actually engaging with that. And the second piece, of course, is actually just having great experiences to create appointments. And I think most of you are really aware of this, but that means a lot of different things given the many different care environments we have and the different service lines that we have. So we need great experiences for primary care and for specialty care and for urgent care and, for telehealth. Like there are many, many different flows that are needed based on what people need experiences for. We need to be able to support many, many, many of these. And again, for new patients as well as for existing patients. It's going to be the catalyst for the next stage of evolution of healthcare's digital experiences. We are still information forward sites that have some transactional capability. And when you look at the sites that we're being compared to in travel, in dining and in all these other places, they are transaction forward sites that are supported by a lot of great information, and that transition can't happen until we have much more robust solutions in this space. Going back to that data around importance and capability, I know this is a very different presentation of that data, but it's the same thing as that eye chart that I showed a minute ago. We also look at where the biggest gaps exist. So it's not the most important thing, but the biggest gap between importance and capability right now is in personalization. The good news, again, is consumers have given us the green light to create personalized experiences. They want them, they're frustrated when they don't have them, they trust us to keep and manage this data. This is a technology that a lot of organizations have flirted with, but it's time to really start putting it in place in a more significant way. And I will say that this is a set of technologies that has a lot of capabilities and potential beyond what I think a lot of people think about when they're considering this as part of the tech stack. As systems get bigger, personalization allows us just to give greater relevancy to what any individual sees based on geography, for instance, while still leveraging the benefits of having a big enterprise web presence and all the search engine advantages that gives, all of the branding advantages that gives along the way. We can use other elements like day parting to highlight the care options that are available right now. If someone's coming to the site at 2 o'clock in the morning, we might want to highlight different care options than if they're coming and looking at the site at 10 a.m. And then, personalization has all kinds of applications around digital marketing as well. Customizing landing pages, for instance, based on different variations in messaging and creative that you might be using to test ads. Right now, it's pretty painful for a lot of organizations to run a lot of variations of ads and do a lot of testing. Like this is a set of tools that can really help make some of those things a lot more achievable. And so there's many applications here that are low-hanging fruit to get started with, to deliver value quickly, and again, build the case to continue to invest here and build into enterprise caliber personalized experiences. Finally, this is a great time to be getting aggressive with digital patient acquisition activities. Right, we talked about patient loyalty at the beginning of this presentation, and it is a challenge, but it also is an opportunity. The loyalty challenges that we're seeing are happening all across the industry, and while this may put your patients at risk of poaching, it also means that patient acquisition is easier than ever before. So if you have capacity in your services, and that's a big if, I know a lot of organizations are struggling there right now, but if you have capacity, this is a really great time to get much more aggressive with your digital patient acquisition strategies to grow those service areas in different ways. But while patient acquisition is necessary, it is certainly not sufficient. So there's a lot that we need to be doing to track and manage the patient satisfaction issues that we are seeing out there that are leading to that malaise and that readiness to look at other options. map the journeys that your patients are going through and design experiences that are just easier and better than they've been in the past. And look for new ways to connect with those consumers, to nurture your patients, and to engage throughout their journey. And that's really sort of the key to building greater loyalty ongoing. So that's all the time that we have for today. I'm happy to keep the conversation going. I believe you'll get a PDF of this. You can just click on the different links to engage. Again, also go out to our landing page for this, geonetric.com/Beckers23. It's got the resources that we talked about and hopefully delivers some other things that can help you execute in the coming year.